Yeah. No, you had to, I think, press, for playing the video, I think you should press the, okay.
Oh.
The video may not be playing.
Sorry about that. So yeah, I'll be talking on importance of surgical blades in wound construction, phacoemulsification. So wound construction plays a very important role in the success and safety of phacoemulsification. So precise incision ensures chamber stability, minimal leakage and optimal healing. So ideal phaco-incision requirements, it should be self-sealing and watertight, it should be astigmatically neutral with minimal distortion, and it should be reproducible and safe for repeated use. Types of surgical blade used are metal blades, diamond blades. Metal blades are cost effective and they require frequent replacement, but diamond blades have superior sharpness and consistency. So there are multiple range of these blades available. So sideboard crescent knives, the keratome, the clear cornea knives, and the MVR blades. So these are different models of sideboard knives. So the one that we use in our setup is a 15-degree blade. So this is a Can you please help me with the video? Yeah, you can just open that. Yeah, so this is the video of the sideboard blade that we use. It's 15-degree. So this is the one that we use for our phacoemulsification. So let me just get back to the presentation. Yeah. So then we have the keratome knives. One of them is a single bevel and the double bevel one. The one we use is KR28. So this is the video of the same. It's a 2.8 mm keratome knife. So we make the initial groove. And then we make a triplanar incision. So then we have the double bevel keratome knives, and coming to clear cornea knives, we have the single bevel as well as a double bevel ones. So the difference between the keratome and the clear cornea knives, that keratome knives are a little longer with a smaller angle at the tip, and the clear cornea knives have a larger angle compared to that of keratome. And the edge of these knives, they stand out with a smooth surface finish, and this is the picture showing the same when you compare with the grinded knife. So blade geometry is very important because the bevel angle determines the entry and the wound construction depth. So proper tunnel length ensures a self-sealing effect. So it's very important that you look for a good blade geometry and incision architecture. So steps in proper wound construction is that you mark the entry site on the clear cornea and use consistent entry angle to form a two-plane incision. Maintain a uniform tunnel length, that's very important to prevent any leakage, and avoid any excessive manipulation to prevent any wound distortion. So in clear corneal incision, temporal one is preferred because the horizontal diameter of the cornea is 1 mm more than the vertical diameter, and it also interferes less with the visibility. And there is ease of surgery in deep set eyes and less pooling of fluid into the fornices. So we have to maintain the length of the tunnel as well, and it allows easy entry and mobility of the phaco probe and prevents any incision burn. So the most common types of clear corneal incision that we do is a triplanar. We also do the biplanar and the uniplanar. So triplanar incision, we do an initial vertical groove and then we make the intercorneal plane or the tunnel, and the inner lip is straight and it's parallel to the initial incision. It's parallel to the plane of the iris. Then we have a biplanar incision where after the initial groove, the keratome is directly made entry into the anterior chamber. And in uniplanar, the incision it's made in a single plane with a single stab incision. Limbal incision is a good compromise between the clear.
You just have a
Sorry,
half
can you
a
please
minute.
give me half a minute?
Half a minute.
Yeah, limbal incision is a good compromise between the clear corneal and the posterior limbal incision. And sorry, the slides are not moving.
It's okay. You can continue. Moving.
Okay. So there are some issues with the clear corneal and limbal incision. We have to avoid any torn edges, avoid any premature entry, maintain the tunnel length, and tunnel length shouldn't be too long also, and avoid any leaky wounds. And the shape of the incision should be accurate. Avoid any DM strip or DM attachment when we insert the blades, and any conjunctival infiltration by saline also should be avoided. So we have to be very careful. Even also look for the iris prolapse. So there should be a controlled installation of any fluids in the anterior chamber. So these are some common errors and consequences. So improper angle, entry angle is can cause wound leak or dismiss detachment. Too short or too long tunnels also can cause other complications. So always inspect the blade tip. Just 30 seconds more, please. So always inspect the blade tip. Replace the blade frequently whenever required. Hydrate the wound adequately and monitor for the wound integrity before you close the case. So high quality blades play a very important role for optimal wound construction. So incision geometry ensures safety, stability and good recovery, and attention to wound construction impacts the surgical outcomes. Thank you.
Thank you, Dr. Aparna. I think we'll go to the last presentation by Dr. Sharath Hegde. So can we have Dr.